Hi guys, so just want to give an update regarding one thing which you can learn in healthcare business analyst. If you work as a healthcare business analyst, or if you are starting a career as a healthcare business analyst, you can really learn something about claims and eligibility. So those are the important factors, and also the HIPAA complaints. Okay, claims, how the in the claims there are a lot of processes, like the claims are paid, claims are denied. So let me talk something about the claims. So claims is something which doctor or providers here in US, what happens is doctors are also called as providers. So providers will demand the money from the patients. So definitely they will trade the patients. So patients will not directly pay them. It is completely paid through insurance companies. So what doctors or providers needs to do is they have to claim those money from the insurance companies. But insurance company will have their own, they have their own clauses. It's not something that, if they, for example, if they ask for $100, it's not something that insurance company will pay the complete $100. It is divided into a lot of things. Okay, the $100 will have the patient responsibility of somewhere like 5 to 10%, or it may differ depending upon the rules of insurance company. So let's say if it's $100, $25 is something which is paid by the patient, so rest is $75. Even out of that $75, what will happen is insurance may pay some $30. So the $25 will be write off. Write off means provider's write off. It's called as provider's write off. Means it will be written off. So it's not completely paid by the insurance companies, because they have their own rules. Okay. So this is regarding the claims. Okay. And the claims will get paid. Sometimes the claims will get entirely denied. Denied means it is not completely paid. Denial can be, can be a lot of denial reasons. One example I can give is COB, that is coordination of benefits. That means there are some benefits which needs to be shared by patient. Okay, it will be something like a document which the patient has to give, and whether the claim is paid or denied, it will come in the form of EOB, that is explanation of benefits. Okay. So I'm able to speak about all these things because I've worked in medical billing, so which is also part of healthcare domain. So these things you can learn, and there is something called as eligibility and verification, wherein the patients, it is checked whether the patient is eligible for that insurance. Eligibility means whether his policy is expired, or whether the policy is active, and if it is expired, when it is expired, whether it's expired now or few years back, and whether that particular insurance covers all the benefits. What are the benefits if the patient is eligible? What are the benefits that is covered in those insurance companies? So those are also seen here. And you can get some information about the insurances. So there are two types of insurance. One is the government insurance. In US also you'll have government insurance, and one is commercial insurance. The commercial insurance, there are five major insurances: BCBS, Blue Cross Blue Shield, Aetna, Cigna, UHC, which is United Healthcare, and Humana. And in government insurance is also called as federal insurance, where you'll have Medicare or Medicaid. Medicaid is something which is mainly for child actually. Okay, so this is just some basic information which I've given, which is part of healthcare business analyst, where you can learn more about claims and claims adjudication and denial management. And there is something called as RCM, which is revenue cycle management. Okay, so some basic informations I've given. I can come up with more information in the next videos. So these are something which are very useful. It may help you in some of the interview questions as well. Okay, so that's the reason I've shared and I've discussed this. Okay, thank you.